It says set up live video.
Yep, it's setting up. It's almost there.
Oh, okay.
It's now live.
It's live. Am
Mhm.
I live? Hello. Hi, everybody, and thank you for joining us today. I'm State Representative Chris Campbell here in Indiana. This year and last year, I offered legislation to start newborn screening for cytomegalovirus, or CMV for short. CMV is the leading infectious cause for birth defects in newborns, occurring in about 1 in 200 births, and can cause a wide array of birth defects. So that's why it's been really important for me to get this legislation passed. Let me tell you a little bit about cytomegalovirus. It's a virus. The mother can get it anytime during the pregnancy, and during the pregnancy that can pass to the fetus, causing the fetus to carry that and to start to not develop properly, and also acquire birth defects after birth. Are we posting the screen? I never did see anything. All right. So this first slide that I'm going to show you shows you how often birth defects will occur among the different races. In Black children, it actually occurs between 9 and 11 births out of the 1,000 births. It's about 4.5 per 1,000 live births, but we see that's a little bit higher in Black babies. In multiracial babies, we see it's even higher. It's anywhere from, it looks like about 5 to maybe even 12 births out of 1,000 births. White or Hispanic, we have more of the around 3 to 4 births out of 1,000, and non-Hispanic whites about the same. And Asian, we see a little bit less, even less than 1 to 3 births. And then in multiracial, we see the highest number, that 4.5 to 13 births. So let's go on to the next slide. So when we think about it, as far as the types of birth defects that can happen, there's a list of different types of birth defects that are pretty common. This is the range of birth defects by the amount that will happen. And as we see, congenital cytomegalovirus, congenital meaning at birth, CMV disease, is the leading cause in this group of birth defects. In almost 6,000 annually are born with cytomegalovirus, which could cause the birth defects. And just under that is Down syndrome, which people are a lot more familiar with, occurring less often than that. Fetal alcohol syndrome is right behind that. Spina bifida and encephaly is lower than that. And then, of course, it goes down from there. In our next slide, this shows how, cytomegalovirus is also actually the leading cause of hearing loss in all children. And at birth, that only occurs in about, we see about 21% of the overall babies that have hearing loss at birth is because of cytomegalovirus. And then that hearing loss can actually occur anytime from birth to 4 years old. So at the by the time we look at all children, we by the age of 4, 25% of hearing loss is because of cytomegalovirus. So we can go on to the next slide. So I talked a little bit about how congenital cytomegalovirus is the leading cause of birth defects. This slide shows us not only how frequently these things occur, it shows us how much people know about it in the public. Of course, a lot of people know about HIV and AIDS and Down syndrome. A lot of people are quite aware of those things. Yet when you look at the knowledge of how often HIV or AIDS occurs in a newborn, the number's extremely small. And of course, Down syndrome has been around for a long time. We're very aware of this. People understand what it means if their child's born with Down syndrome. And you see the knowledge is on the left side shows that people are quite aware of this disorder. And then you kind of go up. It's like, people are pretty familiar with spina bifida. Of course, the numbers start to decline. Sudden infant death syndrome. We're quite aware of sudden infant death syndrome. I think we've done a lot to address the issue. And I know when my kids were born, they had to sleep on their side. I mean, they're constantly looking for ways to help prevent the issue of having sudden infant death occur in babies. And the knowledge is really high, yet the incidence, if you look at the right side, is way less than Down syndrome. And if you look at all the way to the top, look how often cytomegalovirus occurs in births, over 6,000 a year throughout the country. So in this conversation today, we're going to talk about cytomegalovirus. I have a couple parents here who are going to tell you about their stories of when they discovered the birth of their children, and they're going to share their stories about when they learned of when their child was diagnosed and some of the issues that occurred over time. I think I did have I was going to share another, it's probably pretty far down, but I will just probably tell you about it. If I can find my list of the different types of birth defects that occur. Okay, so right now, only about 10% of the babies born with cytomegalovirus will actually have symptoms at birth. There are, I believe, about 15 states, and Amanda, you can correct me on that, as far as how many states are actually doing newborn screens. So 10% of babies born with congenital cytomegalovirus will have birth defects, and that can vary. There's a large range. There's different types of rashes, the petechiae rash, the purpuric rash, jaundice, microcephaly, seizures. There's quite a few things that can occur. And in those states, those 10% of babies born with cytomegalovirus go on to be screened for cytomegalovirus. So we're only identifying then, that 10% of that 6,000 births that may go on to develop other birth defects. So that's why, one of the things that I wanted in my bill this year and last year was to have universal screening of cytomegalovirus. So we wouldn't be missing any of the other 90% that are born. So we could actually identify those babies that are born. When they are identified, the I think it's taken a little more seriously if they've a lot of our babies that we do newborn screens on, hearing screens, which we do in Indiana, we do newborn hearing screens. We lose a lot of those babies as to the follow-up. A lot of things can interfere with a hearing screen at birth. Of course, they've just been born. There's a lot of fluid. So we tell the parents, yes, they failed, but it could be because there's a lot of fluid, and we really need to check them in a couple weeks to make sure that that's really a hearing loss, or if it's because of the fluid. But we end up losing a lot of those babies because they don't do the follow-up, and then we may not see them till farther along the line. One of the things about identifying a hearing loss at birth is once we do identify that hearing loss, if we can get a hearing aid on that baby as soon as possible, they're likely to develop normal speech and language development and maybe never need speech therapy or anything like that. So, early identification is always really important. Also, we're going to take a stronger look at that baby to see if there's any other issues that are occurring that are prominent with cytomegalovirus, but we're also going to monitor that baby more closely because a lot of these things can develop over time. Like I said earlier, that hearing loss, even though it may not be present at birth, it can actually occur anytime from birth to 4 years old. And it also can occur in one ear. And it can be a fluctuating loss. So, a lot of times maybe you'll think, oh, well, they must just have an ear infection, and then they get treated for an ear infection. So it delays how soon we can identify the baby with the hearing loss and make sure that they're handled appropriately. Is anybody having any questions? Has anybody showed up on our Facebook Live yet? Jalen or Tylea, you can let us know if there's any questions. Please ask us questions along the way. If anybody's watching us, we're happy to answer any questions.
No questions just yet.
Okay, well, let's move on then to Amanda, who is from the National CMV Foundation, and you can tell us a little bit about more about yourself and how you got involved with the foundation and anything else that you think might be important for our listeners.
Awesome. Can everyone hear me okay? So I think, Tylee, I think you have a slide for me. And so I just always have to say everything I do for CMV, I do for my daughter, Pippa. She's 5. She was born with CMV in 2015. And she was one of the faces of the CMV law that we passed in Iowa. So we refer to that law as Pippa's law. That was passed in 2017. So my contact information's on here. I'm actually a nurse by trade, and I started officially with the National CMV Foundation about a year ago. Before that, I was mainly a volunteer with the organization and just did advocating in my own state. So just to tell you a little bit about the National CMV Foundation, we are really the only national nonprofit dedicated to congenital CMV. So we want to be one of the first places that families look when they're trying to prevent CMV, when they've gotten a CMV diagnosis. We want to be that main source of information for people. Our mission, recently updated, is to prevent pregnancy loss, childhood death, and disability due to congenital CMV. And we do this through a variety of ways. We fund research. We've funded early career research awards in the CMV space. We have a CMV Community Alliance program, which is like an ambassador program. We have currently 10 volunteers who all happen to be CMV parents. who are working on advocacy efforts in their areas. And we're hoping to expand that program this year, maybe double it even if we can get enough interest. We would love to do that. We do education and outreach to providers, to families. We provide educational materials, all available on our website for free. We do some legislative support, so we do not directly lobby for bills, but we will provide support, letters of support. We can kind of help people connect with other CMV advocates in their state, connect people with others who have passed similar bills in their states to kind of help get the ball rolling on legislation. We also advocate for CMV screening on a national level. We have worked hard to submit a nomination for CMV to the RUSP, the Recommended Uniform Screening Panel. I always want to say universal. So that is in the process of happening. And hopefully we'll get that approved at some point so that this can be a nationwide universal screening that all babies get. We advocate for CMV vaccine. There's many companies working on that. There are trials happening and recruitment for trials through a few different companies. So we're happy the progress that is making, because that would really be the best scenario, is if we didn't have to worry about CMV at all and it was just prevented with a vaccine. We also provide some family support. We get a lot of questions coming in through Facebook, Instagram, on our website. I field emails. We're happy to connect families with professionals who know about CMV. Sometimes our families or people who are pregnant and get a diagnosis, they don't really have anybody who is well versed in the subject. So we're happy to provide information to those families who are dealing with the CMV diagnosis. I did want to come back to what you asked me about legislation. I believe, gosh, it's hard to keep track because so many states have so many different types of laws related to CMV, but I believe we have 13 states with some type of legislation. However, I think only 6 are doing screening. Screening was part of the legislation in 6 states. That is not to say that those are the only place where screening is happening. A lot of screening is happening through health systems, through individual hospitals. You know, they have CMV champions who really have pushed it through, and they're doing their own screening. So that's pretty much it for me about the National CMV Foundation, and I'm happy to take questions, or anyone is welcome to reach out to me via my email. So thank you. Thank you for having me.
Thank you so much, Amanda, for that information. Joining us also today are 2 parents who are going to share their stories with us. I really appreciate your coming. And why don't we go ahead and start with Sandra? And could you tell us where you're from and tell us about your story?
Well, thank you so much for inviting me to be on here today. It's very near and dear to my heart. I am originally from Indiana, but my family has also moved to Texas, and now we're in Pennsylvania. And our daughter was born at 36 weeks, and she had no outward abnormalities. Her head was a little small, so we monitored that, and by 6 months of age, it hadn't resolved. So the doctor sent her for an MRI, and it showed that she had polymicrogyria, which is a brain malformation. It was basically encompassing, half of her brain. So at that point, they said, let's send her off for all these genetic tests. So we went down the genetic test pathway. And in the meantime, while waiting for all of that, I swore she couldn't hear me on certain sides when I was talking to her. So there went the hearing loss diagnosis. And shortly after, she was diagnosed with seizures. She was diagnosed with cerebral palsy. Just all these very difficult things. Here she is in her first year of life, but no one ever mentioned CMV, and it was through my own just kind of Googling things online that we were able to retrieve her newborn blood spot with the help of a wonderful infectious disease doctor in Texas. And sure enough, her newborn blood spot was positive for CMV. So I call what we went on a diagnostic odyssey. And in that time, she missed out on early intervention. She missed out on antiviral treatments. A lot of things that may have helped her outcome be different. And so therefore, I'm hoping, thanks to, Representative Campbell for her efforts and advocacy. I mean, I don't see a better cause than protecting, the most vulnerable of your constituents. It's a very wonderful cause. So thank you.
Thank you so much, Sandra, for sharing that story. I oftentimes share your story after you sent me your message a year ago when I think maybe your mother contacted me. So I really appreciate that you came today and shared your story. Another mother we have is Holly, who's also has a story to share about her child. And thank you so much for joining us.
Hi, guys. I hope you can hear me. Thank you so much for having me. I'm grateful for the opportunity to share our story. My daughter, who is 6, her story kind of started during pregnancy. Around 17 weeks of pregnancy, I displayed symptoms of an illness. At that time, it was unknown. At the 20-week fetal ultrasound, they did notice some abnormalities in her brain. So they kind of investigated a little further. All abnormalities were considered normal variants during the pregnancy. They did check me for CMV, and oddly enough, my blood work was negative for CMV at the time. So after we delivered her, it was noted that she did have the petechiae rash, microcephaly, a lot of the things that you had mentioned, Representative Campbell. So they did not mention testing her for CMV. We did, however, get set up with a neurodevelopmental physician who evaluated her, and due to her microcephaly, pushed for an eye exam, normal eye exam. He ordered imaging, and Maya as well was noted to have polymicrogyria. At that point, the neurodevelopmental physician felt like CMV was a big possibility. We retrieved her newborn blood spot as well, and it was positive. And he checked her urine, and she was positive as well. At this point, she went for another eye exam, and that was about a 6-week difference. And in that 6 weeks, she'd started developing a scar on her left retina already that was affecting her vision. Maya did get a chance to start her antiviral medication at this point. And I'm with Sandra on this one. I want to advocate for other children. Maya did take 6 months of antiviral therapy to help suppress the virus from doing continuous damage through the first year of her life. Maya has gone on to have seizures, cerebral palsy, difficulty with eating, difficulty with speech. But I do have to question if the antivirals did help her from progressing further with her diagnoses. My big hope for this advocacy is that other children do get tested on their newborn blood screen, and they have the possibility of starting antiviral therapy if diagnosed positive with CMV. These kiddos deserve a chance. So thank you for having me. I appreciate it.
Thank you so much, Holly. I really appreciate your sharing your story with us. We have another guest today, Ann Summers, Dr. Ann Summers, who is an audiologist from Purdue University. I asked her to join us today. Did you have some things that you would like to share?
Representative Campbell, thank you for inviting me. I am so sorry that I was lost track of time. We
That's
are in the
okay.
process of interviewing a candidate who is in Australia. So there's a 12-hour time difference as we're meeting with this candidate on Zoom. And all of a sudden I went, oh my, I have to leave one call and come to another. So I apologize for being late, but I'm kind of in, I'm not sure what time zone this poor
That's okay.
candidate is in.
I skipped out on the budget for Indiana just to come to this. So
There you go. But like I say, I really appreciate, I'm sorry I was late, but I appreciate you sharing your stories, and I wholeheartedly support Representative Campbell on getting this legislation through. It is so important. I've been an audiologist for 30 years, and we see a lot of children through first steps and early intervention, and it's so critical that we start that process early, and if we have information, that is power. And so I think that's going to be key to helping educate other legislators as to the importance of why we're advocating for CMV screening. So so I really just appreciate Representative Campbell's leadership on this, and I am really here to help support you and the process in any way I can, whether that's lending testimony or letter writing or communicating with all my audiology friends to help. Please talk to your legislators and share the word. So I'm just grateful to be here tonight. So thank you for all you do and for your support. And like I say, we have to advocate for those who can't. So it's important that we do that in whatever that looks like. So anyway, so thank you, and I will. So sorry to butt in late.
Oh, you're fine. You're fine. I appreciate you joining us. So has anybody asked any questions yet? Our monitors? I'm not sure if we're streaming on my personal page or my campaign page, or there may have been a little bit of confusion about where that event was.
And yeah, we're on both pages.
Oh, okay. All
yeah,
right.
We just keep sharing it to get it out.
Okay. All right. Thank you.
Yeah,
well, please, if anybody has any questions, please put them in the chat. We'd be happy to try to address any of your questions or concerns. So this year, I was a co-author on the bill for getting newborn screening, a universal screening for cytomegalovirus. Cytomegalovirus can be tested with a saliva swab. It's a very inexpensive saliva swab. It is currently recommended if the baby has symptoms to be screened. However, just having the recommendations, your doctor or pediatrician has to pick up on that and decide whether or not that's something they want to test for. So many times, if it's the petechiae, or as in 90% of the cases, there will be no symptoms whatsoever. So those babies are going to get missed. You're allowed to ask that your baby be screened at birth if you have concerns or would like to know, and it doesn't hurt. Your insurance may not cover it, but it's to me, it's probably worth not having the headaches, or just the issues that some of our families experience when their baby starts to become sick and they don't know why. So this really kind of gives you an idea of what to look for. It allows your pediatrician to look a little closer at that baby, especially if something just seems a little bit awry. I think they're more likely to consider that it's an issue rather than the wait and see. And that wait and see can lead to more developmental problems or issues that need to be addressed sooner. So you can ask when your baby's born to have a cytomegalovirus screen. Your hospital may have to figure out how they're going to run the test. But as long as the baby is tested before 21 days, You may be able to even do that with in your first visit with the pediatrician. Just let them aware that this is something that you want to have tested at birth. We can't test the moms because you could have cytomegalovirus at any point during the pregnancy, and we would never know that you had it. Like our mother said that she was sick, started to notice there were problems, but and until the baby's born, we can't identify that for sure. It's picked up pretty high in the saliva. As Holly said, they actually did the blood dot and the urine test. Those are usually a little less sensitive, but yours came back positive. So they were able to identify those things early. The baby had symptoms. When babies have symptoms, they can treat them with antivirals. They usually don't use the antivirals with babies that don't have symptoms because antivirals are pretty toxic or I don't know the best way to say that, but it's just something you would want to use it if you're sure it's going to help. And in those babies that have symptoms, using the antivirals, and as Holly said, for the issues that they did face, they may have lessened the severity of those issues. I know I did meet a mom last year when I was working on this bill. They said that the baby was born with one of the classic rashes. And then after much testing, they found out that it was cytomegalovirus. The baby was treated with the antivirals. And when I met her, the baby was about 1.5 years and wasn't having any issues whatsoever. So that was, one of those really good stories that you want to hear. I would just like, with this legislation, to have more of those stories, identifying these babies like we saw. It's so common. It's happening so often. Yet we're just not testing yet. So I'm going to continue to work to try to get that testing done. I encourage people in Indiana to contact their legislators and make them aware of this, especially if you've had a child that was born with cytomegalovirus and want to encourage this type of legislation. Please contact your legislator. You can go to iga.in.gov. There's a menu. You pull that down, and there's a find your legislator. You just put in your address and it will pull up all of your legislators. And I know that they're also trying to get this at the federal level too. There is the recommended newborn, what does that RUS stand for? Somebody jump in and tell me.
Recommended Uniform Screening Panel.
Yes, the recommended uniform screening panel. That they test for so many things at birth. If you've had a baby, you know that they do some blood dots and they check for a lot of different things. But this is the number one thing that they could possibly have, and it is not being tested for in Indiana. So that's why I'm going to continue to try to get this passed in the state. Does anybody else have any thoughts or something to share? I know we want to bring up our contact information again, which we didn't add, Anne, but hopefully we'll have this event in the future. And but if you want to contact any of us, if you have additional questions, please send us an email or give us a call, and we will try to connect you to the information that you need. I really appreciate everybody joining us tonight. Thank you so much to Sandra and Holly for sharing your stories, and Anne for jumping on to share your support, and Amanda for all the work that you're doing with the National CMV Foundation. Is anybody else?
Thank you to you for all your work in Indiana. We appreciate it.
You're welcome. Well, unless there's any questions, I think we can probably call it an event. And we appreciate everybody for joining us tonight. And again, these are our contact information. If you have any questions, please reach out to us.
Hi, Campbell. I actually have a question.
Oh, go ahead.
Yes. So how can I prevent CMV during pregnancy, or is there any thing I can do?
Oh, that's a really good question. Thank you so much for asking that. During pregnancy, one of the most absolute important things you can do is just one of the things we've learned during this COVID outbreak is to wash those hands. That's one of the most important things you can do is because, you know, like any type of virus, you could just touch a handle, rub your eye, and especially oftentimes, especially if you have another child, a lot of times that gets passed on to you by changing diapers. Mom gets busy, she doesn't change your diaper, wash your hands right away. So it's really important to just, you know, try to keep those hands clean, and that'll help that. Thank you so much for asking that. That was a really good question. All right. Well, again, thank you for joining us tonight. And hopefully we'll do this again. All right, we could go off.
Okay. Yep. Thank you, Chris. Thank you, everyone, for sharing your stories. It's an powerful message to spread the word.
Yes.
So thank you for that.